So hello everyone. So this is just a practical demonstration of the specimen of spinal cord. So here the parts of the spinal cord you are supposed to identify in your practical exam point of view. So first we have to know that the average length of the spinal cord is around 43 to 45 centimeter in case of adults. So this 45 centimeter spinal cord extends. So extension you have to know from upper border of C1 to lower border of L1. This is the extension of spinal cord. Remember, at the lower end of the spinal cord is terminating as a conical end, that is called as conus medullaris. So as an external feature, you can identify the conus medullaris at the lowest end, conus medullaris. Okay. Further, below the level of conus medullaris, we don't have spinal cord specimen, but we will have this one. Spinal nerves are there. Lumbar and sacral spinal nerves are there. Plus, there is a pale modification called as phylum terminale. I will explain about it. Everything together resembles like the tail of horse. So these structures are called as Korda Equina. So you have to remember Korda Equina as another external features. So you identify conus medullaris and Korda Equina. Okay. And this is the picture to show you how spinal nerves are attached to the spinal cord. We have learned spinal nerves are attached to spinal cord as two roots. One is in front, that is ventral root. One is behind, that is dorsal root. So ventral root will be arising from anterolateral sulcus and the dorsal root from posterolateral sulcus. Attachment to the spinal cord will be in the anterolateral and posterolateral sulcus respectively. So next we will go through the meninges of the spinal cord, that is called as spinal meninges. So in these pictures you can identify the dura mater, arachnoid and pia mater respectively. So first thing, the dura mater, spinal dura mater, that is as usual like the cranial dura, that is very thick and outermost one. The cranial dura mater itself is continuing through the foramen magnum to continue as spinal dura mater. So in this picture you can see the thick outermost part, that is the dura, spinal dura. Next is arachnoid matter. Arachnoid matter is comparatively very thin and transparent membrane. So that is inner to the dura. Here in this picture, this is the area of arachnoid matter that is thin and transparent. And you know, in the theory we have learned that deep to the arachnoid we have the subarachnoid space which contains CSF, cerebrospinal fluid. Next is the pia mater. Pia mater is very closely attached, thicker but closely attached to the spinal cord substance, very adherent to it. But pia mater is showing some modifications in case of spinal cord. So first thing, phylum terminale. What is phylum terminale? You are supposed to identify in the specimen of the spinal cord phylum terminale. You know, from the conus medullaris, the pia mater will further extend downwards. So that will be structurally a very thin thread-like glistening structure. This is called as phylum terminale. So dura mater and arachnoid matter will be extending up to S2, second sacral vertebral level. But remember the pia mater, after covering the conus medullaris, that will extend further downwards as phylum terminale, that will be extending further below till tip of the coccyx. Okay, so this is phylum terminale. So you identify among the lumbosacral nerves, you can identify the phylum terminale, that will be glistening and thread-like downward extensions. Another modification is ligamenta denticulata. So these are the lateral extensions, tooth-like projections from the pia mater, modified pia mater, thick tooth-like projections. This is located in between the ventral and dorsal roots of the spinal segments. These are called as ligamenta denticulata. So this is also another modification of pia mater. Next, let us demonstrate the cross section or transverse section of the spinal cord so that you can see the internal features. So we have seen that the gray matter is roughly H-shaped, and that is in the inner aspect, and the gray matter, H-shaped gray matter, is surrounded by white matter. So again you have anterior gray horn, posterior gray horn, then you have central canal. Another part to identify is anterior median fissure and posterior median sulcus. Okay, anterior median fissure in the anterior aspect, posterior median sulcus in the posterior aspect. So these are the parts to be identified in the transverse section.